are you?
Good.
I'm Jill. I'm a nurse on your son's treatment team. I just want to talk to you a little today to get a better understanding of everything that's been going on with him before coming here.
Okay, yeah, Sam, he's my son, and he struggled with heroin addiction for 7 years, but I thought he was sober, and he stopped. His sober date is September 20th, 2017. I'm constantly telling him to get a job. He doesn't seem motivated, and I just feel like I'm just pushing him too hard, and all of this is just my fault.
I understand. So what you're saying is you feel like you're to blame for everything that's happened with him by pushing him to get a job?
Yeah, I do. I feel like I am too pushy with him. I don't want him to be like his father. His father was very abusive to the both of us. His father had a drug addiction. And I just feel as though Sam has been into a lot of traumatic events, and that's why he has the drug addiction he has now.
It sounds like you've both been through a lot. Tell me more about your son and everything so we can get a better understanding of this situation.
Well, he did have a girlfriend of 4 years, and they did recently break up because of his addiction. And he got sober, and part of the reason was that he thought that if he gets sober, he can get his girlfriend back. But it didn't happen like that, and now, he's in this situation.
Do you know what coping mechanisms, coping strategies your son uses whenever he's feeling stressed?
He has been facing drug addiction for over 7 years, and so he does depend on drugs to cope. When he is very depressed, he can come talk to me, but usually I have to go and get the information from him. Other than that, he just uses the drugs, and he thinks that helps him, but it really doesn't.
Got it. Has he ever tried to hurt himself before this incident?
No, not that I'm aware of.
Okay. How does this situation make you feel today?
I feel depressed. I feel hopeless. It really makes me sad. I don't know how to handle the situation. I don't know how to help him. And when I feel like I am helping him, maybe I'm not helping him as much as I think I am. He thinks he's helping himself by doing the drugs, but he's really not. And I just don't want him to do them anymore. And I just really can't take this emotional pain anymore because it's a lot for me.
That's completely understandable. Dealing with addiction is very difficult. Seeing loved ones suffering can cause a lot of anxiety and depression for the family members. Thank you for all the information, though. I'm going to go in and talk with your son's treatment team before we go in and talk to him so we can get some help for both of you.
Okay, thank you so much.
So today we have a 29-year-old patient named Sam. He was brought in by ambulance after suffering from a self-inflicted gunshot wound to the mouth playing a game of Russian roulette. His mom found him unconscious on the ground. He was admitted on October 25th. The gunshot narrowly missed his brainstem and he lost consciousness and has been in the ICU in a coma for the past 3 weeks. The patient has a history of substance abuse with heroin. We just talked to his mother and she was unaware of any relapse in his sobriety, but upon admission into the ED, he tested positive for opioids in a toxicology report. His vital signs are stable right now and he's tolerating his tube feeding well. He's been responsive to painful stimuli and is now beginning to respond to verbal stimuli. Dr. Shamara, I recommend that you speak to and assess Sam at some point today now that he's awake. Talk to him about if he has any feelings of suicidal ideation. I also think that we should bring the mother into another room to give him some privacy. He might be a little more open. She seems very shaken up about the whole thing from when I talked to her, so she might need further psychosocial support.
Okay. How's the patient's mood today?
He's a little defensive and very groggy from the effects of his medication and just waking up. His mother's currently with him. She's been by his side vigilantly the whole stay. She was the one who found him after the attempted suicide, so like I said, she's going to need a lot of support as well.
Okay. Good morning, Sam. Sam? Good morning. Hi. Do you know where you are?
No. Where am I? Why can't I see? What's going on?
It's okay. You're at Bridgeport Hospital. You're in the ICU. You injured yourself. Can you tell me what your name is?
I think you just said, Sam, who are you?
My name is Tamara. I'm a nurse. Can you tell me what year it is?
2018, right? Can you please not talk so loud? My head hurts. Why can't I see? What's going on? Where's my mom?
I'm right here. I'm right here next to you, Sam. I'm right here.
Sam, do you know why you're here?
I don't know. I'm supposed to be at home.
Sam, I found you unconscious and bleeding in your room with a gun next to you. I immediately called 911.
I don't remember having a gun. Why am I bleeding? Why would I be unconscious?
Honey, were you trying to kill yourself?
Mom, why would I do that?
I found you with a gun and needles in your room. I thought you were past this. You were sober. How could you do this? Do you want to end up like your father?
I don't know what to tell you. My head is killing me. I can't deal with this right now. Why can't I see?
You have no idea what I've been going through this past 3 weeks while you've been laying here. I didn't know if you were even ever going to wake up. Do you know how that makes me feel?
Okay. I think maybe it's best if we talk to the patient alone at the moment.
You're right. You're right.
Dr. Shamar is here, and I'm going to let her know that you're awake and see if she can come in and evaluate you.
Dr. Shamara. Who's that?
She's our psychiatrist.
I have to talk to a shrink? What is she going to tell me what's going on, why I can't see?
Whenever there's a suicide attempt, every patient must be evaluated to determine the cause of the emotional distress and prevent future harm to self. She's a great doctor. Try to keep an open mind, and you may realize she can help you.
I don't really want to talk, but I guess I'll try.
Okay.
I doubt it'll be helpful, though. She'll just try to put me on psychotic medication, and I'm not crazy.
Okay, Sam. Would you like me to stay with you?
Yes.
Hello, Sam. How are you today? I'm Dr. Shamara.
Hi. I have a splitting headache. I can't see. My mom is trying to tell me that I shot myself in the head, and apparently
Okay, Sam. It's okay.
I've been
Calm
out for
down.
3 weeks, so I'm not doing well.
Okay, Sam. Okay.
Sam, just stay calm.
I need to do a full body assessment on you. Is that okay?
I don't want to be touched.
Okay. It's
I
okay.
can't see you.
It's okay. Just open your eyes. I know you can't see. Just open your eyes. Okay. Let me know if you feel this. Okay.
Can you tell me what's going on?
Deep breaths, please. Can I get your back? Okay.
My head is hurting.
Okay, Sam. So let me ask you a question. Do you feel like hurting yourself?
No, I just have a lot going on. I don't have a job. My ex-girlfriend doesn't want me back. My mom is always nagging. I'm just depressed. I don't think I want to hurt myself.
Okay, but have you ever considered hurting anyone else?
No, I don't remember hurting myself.
Okay, I understand how you're feeling right now, but we're here to help you, okay? So I just did your assessment, I reviewed your labs, I reviewed your charts, and I'm gonna collaborate with the nurse with your recovery and discharge process. Is that okay?
I think that's a good idea.
Okay, one other thing before I go. There's something called a no suicide contract. You can't see, so I can't have you physically sign it. But would you verbalize a no suicide contract with me?
Yes, I don't want to kill myself. I want to live. I want to be sober. I don't want to do this. I will
Okay.
not commit suicide.
Okay. All right. Thank
I will
you,
do
Sam.
whatever I have to do. Just help me, please.
Okay, we'll help you, okay?
Okay.
All right. I'll have the nurse take care of you, and I'll be back with further assessment later on, okay?
Okay, but I don't want to do anything right now. My head is killing me.
Okay.
I'm in a lot of pain.
Okay.
And I'm blind and I don't understand. So can I
Okay.
just I want to
Sam,
be.
so I'm going to leave you now, but I'm going to discuss with Nurse Tamara here some coping strategies for you, okay?
Whatever.
All right, Sam. Thank you for your time.
And we're going to bring you some medication, okay, for that headache.
Yeah.
All right?
Thank you. Okay, Nurse Tamara. So I'll prescribe some Tylenol for him for his headache. He's in a lot of pain, so we'll start off with Tylenol. If that doesn't help, I'll give him some Aleve. Let's continue to monitor his vital signs and LOC. I'll start his discharge planning with the social worker, And also, can you just give some documentation to the mom for some group therapies, and also discuss with the patient some coping strategies that he can use while he's in the hospital?
Okay. And
Okay.
it's very irritable right now too. Okay.
Yeah, I saw that.
Alrighty.
Alright.
Thank you, Dr. Shimura.
You're welcome.
Hi. How are you holding up?
Where did I go wrong?
As I said earlier, none of this is your fault. Dr. Shamar is going to recommend cognitive behavioral therapy for both you and Sam. It'll help with coping with this stressful situation, okay?
Okay.
And then I'll also give you a list of rehab programs Sam can look into for the future,
Okay.
okay?
I just want to apologize for the way I was acting earlier. I'm just really upset and I'm scared and I almost lost my son.
I understand. This is extremely hard to deal with, and your son is very lucky. According to recent studies, gunshot wounds to the brain are the most lethal of all firearm injuries. The survival rates are only 7 to 15%. Did you know that?
Wow.
According to the literature, about 90% of the time, the victims die before even arriving to the hospital. For victims who survive and make it to the hospital, only about 50% die in the emergency room. Each year in the United States, there are about 70,000 victims of gunshot wounds, resulting in 30,000 deaths.
Wow.
Your son, he's alert, he's oriented, he's stable for now. He's on a path to recovery. That's something to be hopeful for. Would you agree?
I agree. Thank you. I just don't think that this should have just happened in the first place. But you're right. Thank you.
Okay, it happened, and now we can just move on from here.
You're right.
So you didn't go anywhere wrong. Addiction and depression is a mental illness that your son clearly needs help with, and we're here to help. So I just want you to know, again, it's not your fault. You both have experienced a traumatic event, and I think it would be best for the both of you guys to speak to a psychiatrist just to talk things out, you know? I can recommend a few places if you like.
Yeah, please.
The most important thing right now is to focus on Sam's healing process and to improve his mental stability. Would you agree?
Yeah, I do.
All right. Very nice meeting you.
Thank you.